So class, we are moving towards our next topic. So yet we discussed that definition, types, incidents, complications, sign and symptoms, pathophysiology, lab diagnosis, complications. Now we discuss about the management. So leprosy occur in patient. Now what we do? So firstly, three types of the management is there. First management is medical management. In that, first we do multiple drug treatment, which is also called MDT. So multiple drug treatment is given to the patient in which number of antibiotics are used. Usually a combination of dapsone, rifamycin and clofazimine. Now next medical management is corticosteroids. So these are used to treat nerve damage associated with leprosy. So we read previously that loss of sensation is there and nerve damage is also occur. So for that treatment we given the corticosteroids to the patients. So corticosteroid is given to the patients for the treatment of the nerve damage associated with leprosy. Third is aspirin and thalidomide are used to control inflammation also. So if patient has inflammation with leprosy, then we given to him aspirin and thalidomide. So these are the medical management of the leprosy. Now what we do after that? So next management is surgical management. These are the second type of management. If medical management is failed, then we do the surgical management. Then in that, first management is neural surgery. So if we know nerve damage is here, so for that we have to do neural surgery. Second is nerve grafting. So sometimes nerves have to nerve has to graft due to that. So we do that. Third management is amputation. Amputation. Fourth is cosmetic surgery. In that cosmetic surgeries we do nasal reconstructions, removal of excess skin, etc. These all about the surgical management. Now our next topic, which are associated with us, which is nursing management. We can do that. How? With nursing diagnosis. We have to make a nursing diagnosis for the treatment of the patient. So first nursing diagnosis of the leprosy is impaired skin and tissue integrity related to infection by M. leprae and loss of skin sensitivity. So here is impaired skin integrity. We know why that is because of the skin lesions. So what we do for that? Interventions are there. First, we monitor the site of the impaired tissue integrity at least once daily for color changes, redness, swelling, warmth, pain. Second, interventions provide tissue care as needed. Third, intervention instruct patient to avoid rubbing and scratching. Fourth, provide gloves or clip the nails if necessary. Fifth, administer antibiotics as ordered by the physician. So these all about the nursing diagnosis of the impaired tissue integrity. Now we discuss about the second nursing diagnosis, which is disturbed body image related to crippling of hands and feet, shortening of fingers and toes, and nose disfigurement. For that, interventions are: first intervention is acknowledge and accept expression of feelings of frustration, dependency, anger, grief, and hostility. Second, support verbalization of the positive or negative feelings about the actual or perceived loss. Assist the patient in incorporating actual changes into ADLS. ADLS means daily activity in daily lives. So next intervention is support the patient in identifying ways of coping. So next nursing diagnosis, risks for injury related to damage on the sensory nerves. We know here is damage of the sensory nerves, so we have to make the nursing diagnosis of it also. So intervention of that are: first, eliminate or drop all possible hazards in the room such as razors, medications and matches. Second intervention is avoid extreme hot and cold around patient at risk for injury. Example, heating pads, hot water for baths and showers. Patient with visual impairment, educate him or her caregiver to label with bright colors such as yellow or red significant places in environment that must be easily located, that is stair edges, stove controls, light switches. So these are the nursing diagnosis of the leprosy. Now we are moving towards our end of the topic. So what we discuss in that? The summarization of the topic we now discuss. So in summarization, first we do the introduction of the topic. We know leprosy is also called Hansen disease, and it is a chronic infection caused by the bacteria Mycobacterium leprae. Second, we discuss about the definition. So definition: leprosy is a chronic infection and communicable disease caused by Mycobacterium leprae. Third, incidence. In this, worldwide 2 to 3 million people are estimated to be permanently disabled because of the leprosy. India has greatest number of cases, with Brazil second and Indonesia third. Types of the leprosy are, we know. What are the types of leprosy? Which is lepromatous leprosy, tuberculoid leprosy, indeterminate leprosy, borderline leprosy. Fifth, we discuss about the causes. What are the causes? Mycobacterium leprae and genetic changes. And further we discuss about the risk factor, which is immunocompromised people. Then we discuss about the pathophysiology, then sign and symptoms. After that, modes of transmission, which is droplet infection and contact through contact and placenta and milk. Lab diagnosis. In lab diagnosis, we discuss main test is lepromin test. Other tests are creatinine, routine test, LFT, etc. Complication. In complication, we discuss about the nerve grafting, etc. Management. We discuss about the management. Multi-drug therapy in medical management, and corticosteroids are given. And also in nursing management, we discuss the nursing diagnosis, and surgical management we discuss about the grafting, nerve grafting, etc.